We're going to have a real good time during these meetings because we will be having these very short 15-minute talks about health. And it's very important because how do we receive the messages from God? Not a trick question. We hear them through our ears, process through our brain, take it to our hearts, right? It goes through our body. So our body is so important. And I'm going to tell you that there's a tragedy in this world right now. I'm going to introduce you to something tonight that many of you may know about, some of you may not know about, and it's called NEWSTART. And I call it NEWSTART, the optimal health plan for Fiji. I think God had this in mind for Fiji. Why do I say that? Well, because most people, if you ask them, hey, do you have a health plan? Most people would say, oh yeah, I have a health plan. You know, the Fiji government has a public health plan, or maybe I have the supplemental plans you have or something like that. But that's not the kind of plan I'm talking about here tonight. My question is, do you have a personal plan for your health? Unfortunately, most people do not have a personal plan for their health. They just kind of follow what's going on with the latest trends, what's available in their neighborhood, what they've learned to like growing up. I grew up on an island. Maybe not as big as Fiji, but it was still an island. It's called the island of Oahu in Hawaii. And what I have found out is something very similar between the Hawaiian culture there and the people of Fiji. How many of you have found that food is central to your life? Okay? Just about every hand is going to go up. In the culture of Hawaii, food is big, very big. And I grew up just eating anything. You know, that was just the way it was. And loving many things that were not good for me. And unfortunately, I watched the tragedy that we see on this slide here. If we're going to put that up next. These are the top 10 causes of death here in Fiji. Diabetes is at the top of the list. Heart disease, top of the list. If you combine that with number 4, stroke, heart disease and stroke together, they call that cardiovascular disease. That would be number 1. By and far, just those 3, number 1, 2, and 4 on this list together, make up like 60% of the deaths throughout Fiji. And I was looking at what the Minister of Health for Fiji has on the webpage and found out that Fijians, the life expectancy is into the mid-60s. Mid-60s. And that is a tragedy. Do you know what the lifespan is in the United States? The mid-70s. And the culture that has the longest lived people around, they live into their 80s. And a lot of people think, well, it's just because of their genetics. You know, the people, for example, the people of Japan are some of those that live the longest, into their 80s, for example. And people, oh, it's just because of their genetics. Interesting thing about the Japanese is when they move to Hawaii, their lifespan drops. If they move to California or other parts of the mainland United States, their lifespan drops into the 70s. Just like all the other people in the United States. It's not genetic. And what they've actually looked at in studies is that many of the causes we just looked at, like diabetes or heart attacks and strokes and those sorts of things on that list, and maybe some of you have relatives that have died from some of these problems. We've actually found out through studies that there's underlying reasons that this happens to people. Why do they become diabetic? The primary reason most people, if you ask them on the street, they'll say it's because it's genetics. But we're finding out it's not primarily genetic. It's not what you inherit from your parents. It's what we learn from them and those around us, our culture. And so what you can see here, when they did a study in the United States, they found out the things that were causing those things, and the things that people die of in the United States is very similar, diabetes and heart attacks, stroke, etc. The underlying issues are these things. And what you're going to notice about these things like tobacco and a poor diet or physical inactivity, I call it the couch potato syndrome. I don't know if you have a couch potato syndrome in Fiji or not, but we have that in the United States. Alcohol consumption, just look at those first four. What do you notice about them? They're all things that you and I make decisions about every day. It's about our lifestyle. Most of this is about lifestyle. And there's a gentleman, a researcher by the name of Dan Buettner, who many years ago, the National Geographic Society had him do a study and look into how people lived longer. Where did they live longer? Went around the world to look at all these different places that people were living longer, and he called them blue zones. People were living like to be 100 years old in many places. And he found out that there were certain areas, Okinawa, Japan was one of them. There was an island in Sicily, I think in Italy, Sardinia, Italy was another one. There were a number of them around the world, but there was only one that was in the United States. And that was in a little town called Loma Linda. Now, for those of you who've never heard of Loma Linda, this is a town where they have a medical center and a university where they train doctors and nurses and other health professionals. The vast majority of the people historically who live there, this university is owned by the Seventh-day Adventist Church. So the vast majority of people who live in Loma Linda are Seventh-day Adventists. And what he identified was that these people that were Seventh-day Adventists were the reason that that population lived so long. Highest number of people living into their 100s. And as he looked at it, these were some of the identifying things that he saw that they were different from other people in the United States. One, they seemed to maintain a healthier body mass index. That means their weight was in a healthy place. They got regular, moderate exercise. It wasn't just physical things, though. They also had social connectedness, where they spent time with like-minded friends on a regular basis. They weren't isolated as they grew older. He also found a very critical factor had to do with what they did with their time. Was it focused on themselves, or did they actually give back to their communities? And that he found that was actually a big difference to the people in Loma Linda, that they were giving back to others in service. They also had a very different diet than the average American. They were eating more plants in their diet. More plants. I don't know about you, but most people in America are not eating a lot of plants. Very meat-centered diet. And then the last one, which is also very interesting, they had what he called a sanctuary in time. Remember, this is not a Seventh-day Adventist researcher. This is a worldly researcher who is identifying what was different about the people in Loma Linda to help them to live longer. But you'll also notice with his list here, these are all choices that people were making in their lifestyle every day. So what's missing in most people's health plan, their personal plan for their health, is a conscious decision on what they're going to do with their lifestyle every single day. Because the decisions that we each make every single day lead to habits. And the things that are habits we do over and over are the things that end up becoming part of who we are. And unfortunately, for many of us, we start off on the wrong foot, like I did in Hawaii, with a very food-centered culture that was eating the things that were killing us all too early. And the burden on my heart is really for the people of Fiji. That's why we are here, to help, because I know that Fiji can do better. In fact, you'll hear from Dr. Leon a little bit later in the week, maybe next week. He was talking today about the blue zones, and he was telling somebody that his dream is that Fiji will be the next blue zone. And that can start only with you, each one in your homes, making a decision to maybe do things a little differently. Maybe some of you have heard of Albert Einstein. Anybody heard of Albert Einstein? I think everybody has heard that he was a pretty smart guy. Do you know what his definition of insanity is? Doing the same thing over and over and hoping for a different result. You know, we've all been doing the same things in our families, and we suffer because of it. I said before that it's not about our genetics. We have a phrase in prevention that says that our genetics may load the gun, but it's our lifestyle, the choices you and I are making each day that pull the trigger. Most of our problems then in the countries around the world, and unfortunately the United States has just spread these diseases everywhere through our fast food and our lifestyle that's very meat-centered. The solution to the problem is not better hospitals, a better physician, more technological advances, or how good your health plan here in Fiji is or isn't good. The solution is about the choices you and I need to make every single day. Good health in today's world depends mainly on what we are willing to do for ourselves. How you and I choose to live our life each and every day. So we will be introducing some of these concepts from something we call NEWSTART. Now, where did we get NEWSTART? We believe that God, who created us, knows what is best for our human bodies. How many of you believe that God would know how our bodies should run? Okay. I should have asked the first question. How many of you believe your Toyota manufacturer knows what to put in a car manual? We understand that the engineers would know. God is the engineer. And it is his desire for each of us that we will be in health. 3 John 2 tells us, "Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers." I said that it's a tragedy that we are dying so much earlier, both in the United States and in Fiji. Think about how God watches as his children suffer with disease and die too early. And he really has given us a solution to many of the problems that we face. And it's just about us unwrapping the solution, which we call the 8 natural laws sometimes. I like to call them the 8 natural gifts of health. And it has to do with what we eat, nutrition, whether we're active or not with our bodies, our exercise, how much water we're drinking each and every day, whether we're getting appropriate amounts of sunlight, something called temperance, whether we are balancing well things that are good and avoiding the things that are bad, whether we get fresh air, whether we're resting adequately, and most importantly, whether we truly trust God. We run a program called NEWSTART Lifestyle Program in California, and we have hundreds of people coming through that program, and over the years, thousands have come through. We've been running the program since 1978. And we have seen that these principles, NEWSTART principles, make a huge difference in people's lives. We have people who, for example, were about ready to die, and they've had reverse disease and been able to go on living for many more years. We've had patients testify that they lived 1 or 2 decades longer than they should have or would have if they had continued on the same lifestyle they were on. They were able to see their grandchildren or great-grandchildren graduate or get married or what have you. And from a Christian point of view, we are here to glorify God in our bodies and to serve others. When we are sick, we aren't able to do as much for others. When we die too early, we've shortchanged God, the benefit of what we could have done for him. So throughout these nights, we're going to share in various ways, either about one of the elements of NEWSTART or focusing on one of the diseases that we, as humans in today's society, Fijian or American, are dying too soon of, like diabetes or cardiovascular disease, or how we can help our bodies function better through nutrition, etc. So we encourage you to be on time so you don't miss this, what we call Health Nugget, each night. Thank you very much.